On today's Coding Corner, we are going to be talking about star ratings. Research shows that people find it helpful when quality is shown in a simple way, like using stars to compare healthcare providers. Star ratings make it easier and faster for patients and families to spot differences in quality and choose the best care option for them. These ratings don't just help consumers, though. They also give home health agencies useful feedback so they can see where they need to improve. When the ratings are kept up to date, they're valuable for everyone involved in healthcare, including patients, families, providers, and others. To make this information easy to understand and accessible, the Centers for Medicare and Medicaid Services, so CMS, began showing star ratings for home health agencies on the Care Compare website in 2015.
In home health care, there are two main types of star ratings used to help patients and families evaluate and compare agencies. The first type is the quality of patient care star rating. What this measures is how well the agency actually cared for the patient. So this is based on the clinical performance data, such as how quickly the start of care was initiated, whether the patient improved in walking, bathing, taking their medications, and if they were able to avoid additional hospital stays. The purpose of this one is to show the overall quality of care that was provided by the home health agency. The second type is the patient experience of care star rating, and this measures what the patients thought about the care they received. So this is actually based on a survey filled out by the patient or their family member, and this includes questions about communication with the agency, with the providers, whether they felt respected, how well the provider listened to them, and their overall satisfaction with the agency. And both of these are updated quarterly. The key difference being the quality of patient care rating is based on objective health data, and the patient experience rating is based on patient opinion and experience. Both ratings give a fuller picture when looked at together. One shows the measurable results of care, and the other shows how patients felt about that care. The 7 measures that are included from the OASIS assessment are M1033, risk for hospitalization, M102, M0104, timely initiation of care, M1860, ambulation, M1850, bed transfers, M1830, bathing, M1400, shortness of breath or dyspnea, and M2020, management of oral medications.
Why are star ratings important to the home health agency?
Star ratings provide a clear, standardized way for patients and families to compare home health agencies, helping them make informed decisions about where to receive care. Since patients often have a choice among multiple providers, a higher star rating can be a deciding factor in agency selection.
Star ratings also reflect the agency's performance. The quality of patient care star rating shows how well a home health agency takes care of its patients, based on clear, measurable things like how quickly care starts, how much patients improve in moving around, bathing, handling their medications, and avoiding hospital stays. A rating over 3.5 stars means the agency is doing better than most, while a rating below 3 means the care is worse than average.
Public reporting of star ratings incentivizes agencies to improve their care processes and patient outcomes. Agencies monitor their ratings closely and often implement changes to improve their scores, which can lead to better patient care overall.
So it also impacts reputation and market share.
Exactly. Agencies with higher star ratings are more likely to get new patients and referrals from doctors because the ratings are seen as a sign of quality, reliable care. Studies show that since star ratings were introduced, more people, especially certain groups of patients, have been choosing agencies with better ratings.
It's obvious that star ratings help make healthcare more open and honest by showing how well each agency is doing in a way that's easy for the public to understand. And this keeps agencies accountable because they know their performance is being watched and compared to others across the country. And this also may influence financial outcomes.
Even though star ratings don't directly affect how agencies get paid, higher ratings can attract more patients. This increase in demand can help the agency make more money and save costs, especially if better care leads to fewer expensive hospital visits.
Let's talk about the current obstacles facing home health agencies. We know that home health agencies face several challenges when it comes to star ratings, but what are those challenges and the impacts of those on the agency? Let's start with this one. What is a challenge when it comes to making improvements with your ratings?
Improving star ratings requires making real measurable improvements in care processes, which can be difficult and time consuming. For example, enhancing patient outcomes like improving mobility or reducing hospital readmissions takes effort and may not show immediate results. The impact this can have on an agency is that it may struggle to achieve higher ratings, especially if they're already doing well, but they can't reach the next level due to small differences in performance.
What are some of the challenges surrounding data accuracy and reporting from the agency level?
Star ratings are based on data collected from patient surveys and other performance measures. If there are errors in the data or if the information doesn't reflect the agency's true performance, it can negatively affect their rating. This can negatively impact the agencies as they can be unfairly penalized for issues outside of their control, such as discrepancies in reporting or patients not accurately reflecting their care experiences.
How does the risk adjustment affect the agencies?
Factors outside of the agency's control, like patients' underlying health conditions, socioeconomic status, or access to resources, can affect their outcomes. These variables may result in lower performance on certain measures, even if the agency is providing excellent care. The impact this has on agencies is that it can make it harder for agencies to improve their ratings, as they are sometimes judged based on factors that aren't entirely within their control.
Agencies feel pressured to improve ratings, which can sometimes lead to focusing more on achieving higher scores than on delivering quality care. This could lead to prioritizing measures that are directly tied to star ratings rather than a more holistic approach to patient care. This can have impact on agencies by making them shift their focus towards specific rating metrics at the expense of other important aspects of patient care.
When filling out a survey on the care they received, what are some of the challenges with getting enough surveys back and those surveys truly reflecting care?
Patient experiences, which heavily influence the patient experience of care star rating, can be subjective and inconsistent. What one patient views as excellent care might not be the same for another, especially if communication or expectations are different. Agencies may find it difficult to maintain high patient satisfaction scores if patient expectations vary widely, even if the care provided is generally very good.
When it comes to competition and public perception, star ratings can impact an agency's reputation and patient volume. So agencies with lower ratings may struggle to attract new patients even if they provide excellent care overall. Agencies with those lower ratings might feel the financial impact of reduced patient numbers, which can be difficult to recover from without significant changes or improvement to their services. When changing guidelines and measures, what are some of the challenges that you're seeing, Tina?
CMS star rating system evolves over time, with new measures and performance standards being introduced. Keeping up with these changes and adjusting care processes accordingly can be challenging for agencies, particularly smaller ones with fewer resources. Agencies may struggle to keep their performance up to date with new requirements, which could affect their star ratings if they don't adapt quickly enough.
So while the CMS Home Health Compare star ratings are intended to improve transparency and help patients choose better care, they can also pose challenges to home health agencies. And these challenges often revolve around improving care outcomes in a complex and sometimes unpredictable environment, managing patient expectations and keeping up with some of the shifting standards that we see. In the next episode, we are going to talk about what a home health agency can do to increase their star rating. So stay tuned. Thank you, Tina and Steph.